Hello, and welcome to episode 15 of our STEM Expo speaker series.
Wow.
Today,
Great.
joining us again, Mr. Chuck Pawlik, and our very special guest. He's an assistant professor of public health at Chapman University, Dr. Jason Douglas. Dr. J, thank you for joining us.
Hi, Doctor.
Hi, thank you very much for having me. Looking forward to talking a little bit about my work.
Absolutely. So on those lines, Dr. J, maybe you could tell us a little bit about your current work and what you've been doing.
Yeah, sure. So just a brief introduction to the type of research that I do. So as a professor of public health, I focus on health disparities. So broadly speaking, what I do is I look at, what is it within our communities that may contribute to uneven health outcomes in disadvantaged communities. For example, I've done quite a bit of research looking at how access to public parks, which are the ideal physical activity settings in the urban context, may promote health and well-being. I also look at the impact of legal drug outlets in our communities, for example, liquor stores, tobacco shops, and how they impact health and well-being, specifically in disadvantaged communities, low-income communities, for example. So for today's talk, what I'd like to sort of share with everybody is a little bit about what I'm doing in the COVID-19 context. So a little bit how I got into the COVID-19 research. I suppose, as a health disparities researcher, when I started to see uneven health outcomes emerging out of COVID-19, that is seeing much higher rates of morbidity or sickness and mortality, death, in our African-American, Latinx, and broader ethnocultural minority communities, I felt a moral responsibility to contribute to the knowledge base of what specifically or why we're seeing uneven rates of illness in our ethnocultural minority communities and broader disadvantaged communities is one reason. Another is a little bit more personal. I actually remember walking into a lab meeting with many of my undergraduate students right at the beginning of the pandemic, and looking at their faces and just seeing a sense of despair, a sense of helplessness.
Yeah.
And with with that emerging moral responsibility that I was feeling, I thought this would be a great opportunity to involve them in this study in a way that they could really take their best step forward and do their best to address this wicked pandemic. So those were the two major reasons that I wanted to pursue this research, an outlet for my students, as well as, a sense of responsibility to the communities that I identify with. So for the current study, and I'm involved in several COVID-19 studies, but one that I'm actually just finishing up, which is sort of phase one of a multi-phase study that I'm running, examines access to health promoting resources in the context of COVID-19 in New York City. Look, New York City really has been the epicenter of the COVID-19 outbreak in the United States, with an exponentially higher rate of cases than we've seen elsewhere. Furthermore, the health disparities, that is uneven rates of disease that we're seeing in the New York City context, are really impacting predominantly African-American and Latinx communities. We're seeing much higher hospitalization rates, as well as much higher mortality rates amongst African-American, Black, and Latinx populations in New York City. So, with my understanding of health disparities, through my body of work, as well as the available research, I've learned that, access to health protecting resources is critical. And much of why we're seeing higher rates of illness and disease in disadvantaged communities is that we don't have access to health protective resources. We don't have as many acres of parks, for example, in African American, Asian Pacific Islander, and Latinx communities in the Los Angeles context, for example. So going back to New York City, in the COVID-19 context, I realized there are a couple of resources that would be very important in our communities. And those included viral testing, number one, to identify where the pandemic is hitting hardest in New York City, as well as access to hospital resources. I mean, this has been no mystery. We've seen across the media throughout this pandemic, physicians, nurses, frontline healthcare workers screaming, saying, we do not have the resources that we need to effectively treat our communities. So with this in mind, I said to my team, let's look at access to testing, number one, and two, let's use hospital beds as a proxy of broader access to hospital resources in our disadvantaged communities in New York City. And so with this, basically what I did is, looked at the testing rate within New York City zip codes, for example. I looked at the rate of positive tests, that is, the rate of folks that were testing positive for COVID-19 within New York City zip codes. And then I also looked at access to the nearest hospital and the number of total beds, as well as ICU beds within every hospital in New York City that A, had an emergency room, 24-hour emergency room, and B, was accepting COVID-19 patients, because not every hospital had the capacity to do so. So running those analyses, I actually found some encouraging findings, and we actually found that there was a higher testing rate in African American, Black, and Hispanic areas. That is, zip codes that were majority African American, Black, and Hispanic. So this was a very good finding, and I found it to be very encouraging in that, historically speaking, our disadvantaged communities have had unequal access to these types of resources. Proceeding with the analysis, when I looked at the rate of positive tests, that is the number of people testing positive in every New York City zip code for which we had available data, what I found matched what New York City Public Health had found, in that, Black and Hispanic communities were testing at a much higher rate. Proceeding with my analysis, looking at access to hospital beds, again, as the proxy to broader hospital resources, ventilators, et cetera. Yeah, so unfortunately, when I looked at access to hospital beds within majority African American, Black, and Latinx zip codes in New York City, what I found was a massive inequity. In fact, comparing majority Black and African American and Latinx zip codes with zip codes that were majority white, for example, what I found was that on average, in zip codes that were majority white, there were roughly 63 hospital beds accessible per 1,000 people of the population, compared to African American, Black, and Latinx communities, wherein there was roughly 11 beds available per 1,000 persons of the population. And that's for total licensed beds. Mm-hmm. When we looked at intensive care unit or ICU beds, the results were equally as stark. Typically, we see far fewer ICU beds in hospital contexts than we do beds. So for total ICU beds per 1,000 persons of the population, there are roughly 3.6 beds accessible to predominantly white communities and communities of other races, compared to less than half a bed per 1,000 persons of the population in African American, Black, and Latinx communities. So this finding, while promising on one end, look, we got hit with a global pandemic, and Governor Andrew Cuomo has been at the forefront in New York, Mayor Bill de Blasio, in terms of trying to ensure that New York City had adequate resources to deal with the pandemic. They did a fantastic job, the administration as well as public health officials, to ensure that we had testing for our communities. However, what my finding regarding hospital bed capacity illustrates is a number of long-standing systemic inequities that have contributed to poor health outcomes in our disadvantaged communities for quite some time.
So this 6-to-1 ratio, have you found that true here in LA also, or is your research continuing there?
That's a great question. So we started off with an analysis of New York City, since that was the epicenter. So now that things are starting to slow there, phase 2 of our project is to fold in other cities. Really, we're going to move into a comparison with Los Angeles City. For a number of different reasons. For example, Los Angeles, very much like New York City, is a large, ethnoculturally diverse city with a range of different resources. Yet, in contrast, it's very different in terms of population density. That is the number of people per square mile. It's also very different in terms of public transportation accessibility. Far more people in the Los Angeles context are reliant on individual vehicle cars, for example, as opposed to New York City. So there are a number of other factors that can contribute to COVID-19 incidence and spread that we want to examine in New York, Los Angeles, and other cities, that will then use toward developing what I'm calling a viral pandemic risk index. And this index will basically take into account a number of social and environmental variables that may help us to predict risk of viral infections, not just in the current pandemic, but for future pandemics, that we're hoping to apply to a number of large US cities, so that we can identify specific areas within our cities and surrounding areas as well that have the greatest risk for a viral pandemic. So we can then begin to prepare for potential future pandemics by allocating resources in a more equitable manner that takes into account a range of other factors, not just population density, but also where the highest risk is.
Excellent. That kind of future thought for this kind of data is so important, with people doing so much research nowadays with the pandemic. So personally, I want to thank you for being thinking ahead and thinking of how this can be applicable in the future. It's fantastic.
And I want to say, so with the research and the current push to reopen everything, do you see further risks coming?
Unfortunately, I do.
Yeah.
Some of my colleagues have been looking a little bit more at the local context and sort of identifying areas where, for example, physical distancing requirements have been rolled back. Personal protective equipment requirements have been rolled back. Beaches have been opened. And they've actually found steadily increasing rates of COVID-19 in those areas. For example, we've seen this over the past few weeks in Orange County, who sort of kept many of the beaches open. Folks were congregating in these areas, and they may have, although we don't have evidence to show that these specific spaces contributed to spread of this disease, there are some associations that are concerning. So I am concerned about, rolling back some of these policies too soon.
Mm-hmm.
And I think, our nation's top public health officials, this aligns with their thinking as well.
Got it. Well, I know you have a hard cutoff time, and we really appreciate you taking the time to join us today. Is there any last words of advice or anything you might want to tell our students?
Absolutely. Listen, for your students, like you're going through training, preparing for, undergraduate training, potentially for graduate school training. If you're interested in this type of research, there are a number of avenues. As a matter of fact, I had a student of yours intern with me a few years back.
Great.
That was a lot of fun. He actually helped to collect some of the parking equity data that I was looking at in Los Angeles. But I would encourage you, if you're interested in this type of work or in public health research more broadly, there are several avenues. Reach out to faculty at our local universities. Many of our educators, professors would be more than pleased to, work with undergraduate students. Often there are formal mechanisms in place for doing so, such as through Rolling Hills Preparatory. And furthermore, read, see what's out there.
Mm-hmm.
Read the evidence. If it really piques your interest, maybe this is something that you could study when you go to college.
Sure.
Maybe you can get into the right research lab that's doing this kind of work. I always say, listen, if you have an interest, get in it and start early, because the more preparation that you have, the better positions you will be for future careers in whatever you want to do, really, whether it be public health, healthcare, or whatever direction you go in.
Great.
Dr. J, I can't thank you enough for taking this time. Thank you.
It's been a true pleasure. Yep. Thanks for the great advice and thanks for taking the time.
It's been an absolute pleasure. Thank you for letting me share a little bit of my research.
Yep.
I wish you all the best. Please do stay safe and healthy.
Likewise.
You too.
Yeah.